Good afternoon. Coming to our second lecture for this week, that is Introduction to Antinociceptive Drugs. In simple words, this lecture is about the introduction to painkillers or the drugs which reduce pain. Now, before we start with the introduction, I will first give you an overview about what pain is exactly. Now, you all know what is pain. So, if something such as dust or sand goes into our eyes, we cannot see it, but we can feel it. So, if a normal, healthy individual, if something goes into his or her eyes, they cannot see it, but they can feel that something has gone into their eyes. That sensation of discomfort or that sensation of extreme discomfort can be referred to as pain. Not only in the eyes, if something is pricking your finger or if there is any problem within the body also, the first thing that the body wants us is by giving pain to us. So pain is nothing but body's early warning mechanism, or you can say it is a body's early warning system that actually protects the body. It is a situation of discomfort. It is a sensation of discomfort, but it serves as a mechanism of protection. So, what happens when there is pain? Do something. So, in a case which I discussed just now, if something goes into the eyes, so we feel pain. So, what do? We either wash our eyes with water or go to a doctor or take medications. So, that is what pain helps us to do. How will we know that there is no pain? That means when the pain is not felt anymore, then we determine that okay, the pain is finished. So any sensation of discomfort is referred to as pain, and this pain is a warning mechanism of the body, and it is actually helping to protect the body and telling us that there is something wrong within the body. Now, pain has always been a barrier in dentistry. So, it serves as a motivation to use drugs either to prevent, block, or attenuate pain, especially in the perioperative period. Now, what happens if the pain is not controlled properly? If there is poorly controlled pain, what happens in dentistry? There are postponements of appointments, cancellation of appointments can be seen, and people might develop anxiety about their future dental treatment. So if the pain is not controlled properly by the dentist or by the doctors, it might lead to the development of anxiety in the patients regarding future treatments, or they cancel their appointments or they postpone their appointments due to the fear of pain. If the pain is controlled effectively, then it reduces anxiety, it helps in good delivery of care, and it improves the dental health also. Now we will see what is the mechanism of pain, how pain is felt within the body. So simple example is with the help of nociceptors. Nociceptors are pain receptors which are present throughout the body. Or in simple words, you can say that nociceptors are pain detectors and they are located throughout the body. These nociceptors, they detect the painful stimuli or the noxious stimuli and they send signals to the brain. So if you can see in this picture, if there is any injury or anything, the nociceptors, the pain receptors in that area, they will be activated and they send signals to the brain and the brain analyzes it and tries to stop it. So are the free nerve endings or the nerve receptors, they are known as the pain receptors, they are known as the nociceptors. Detection of noxious stimuli. Now we are coming towards our mouth, that is the buccal cavity. So detection of noxious stimuli in the orofacial region is conveyed or determined by the nerves of the trigeminal system, such as vagus nerve, glossopharyngeal, facial nerve, trigeminal nerve. All these nerves are innervated in the regions of face and mouth. So these nerves, they contain free nerve endings, that is nociceptors, and these nociceptors, they detect the pain in the orofacial region, or you can say the dental pain. Now, who is responsible to reduce the pain? The drugs, which are known as antinociceptive drugs or analgesic drugs. These drugs are responsible to reduce the pain. They are effective in either preventing or managing the pain in the perioperative period, and these drugs are used for the mutual benefit of the patient as well as the dentist. So if the dentist keeps the patient pain free, he or she can perform the procedure smoothly and the patient will also not feel anxious about his or her dental treatment. So managing pain in the dental office is very important. Now, what do these analgesics do? Analgesics, their broad mechanism is they either interrupt or block the sensations from the nociceptors and they do not allow these impulses to go to the brain, or they depress the interpretation of those impulses in the CNS. So they can act by either of these mechanisms. Either they block the traveling of impulses from the periphery or from the area from where we are feeling pain to the brain, or they depress the sensation within the CNS. The analgesics are classified into two major categories, the opioid analgesics and the non-opioid analgesics. Now we have different drugs within each category which we are going to study in the next week in detail. So today we are just going to see the overview of these classes of analgesics. The opioid analgesics are also known as the narcotic analgesics, and the non-opioid analgesics are known as non-narcotic analgesics. Now coming to the first type, that is the non-opioid analgesics. Non-opioid analgesics are the most commonly used analgesics which we use in our day-to-day life. They are available over the counter in pharmacies also. They include acetaminophen, that is N-acetyl para-aminophenol, that is known as APAP, and the NSAIDs, that is non-steroidal anti-inflammatory drugs. Excuse me. The analgesic efficacy of these non-opioid drugs is similar to that of opioids, and they are best for managing musculoskeletal pain, and they have low side effects and low potential for abuse when compared to the opioids or when compared to the narcotic drugs. So they are good in managing pain, they have less side effects, they are not abused also. That means they are not used for wrong purposes by people. To manage dental pain also, non-opioids or non-narcotic or NSAID drugs are widely used. Most of the researches which are carried out throughout the decades, they have found that NSAIDs are generally superior to opioids at conventional doses. So in normal doses, NSAIDs give good therapeutic benefits when compared to opioids with less side effects and no potential for abuse. Now the prototype drug of NSAIDs is Brufen, ibuprofen. It is used as an analgesic, anti-inflammatory and antipyretic. Now to remember an important point is all the NSAIDs, they have good potency for analgesia, that is analgesics, and antipyretic. Analgesics means they reduce pain, antipyretic means they reduce the fever. So these two effects are good in the NSAIDs. But anti-inflammatory effect, if it has to be achieved, the dose has to be increased when compared to the dose of analgesic effects. For example, if a single dose of 200 to 400 mg of Brufen is used, it will reduce pain and fever. That means it will act as an analgesic and it will act as an antipyretic. But if we need anti-inflammatory action from Brufen, then 1600 to 2400 mg might be required to reduce the inflammation adequately. That means these drugs, if they are taken, if they are taken in the normal dosages which are available, they reduce analgesia and they reduce pain and fever. That means they have good potency to reduce pain and fever. But if anti-inflammatory action has to be achieved, then the dose has to be increased. Drug interactions. Now, NSAIDs will be a problem for the people who have blood pressure or the people who are taking antihypertensive medications because they reduce the effectiveness of antihypertensive drugs, but not at normal usage. If it is used for prolonged period, if NSAIDs are used for a prolonged period of time, then there are chances that they interfere with the effectiveness of most classes of antihypertensives. One exception is calcium channel blocker. Calcium channel blockers are also a class of antihypertensive medications, but they do not interfere or they do not have any drug interaction with NSAIDs. For example, if prolonged use of analgesics is required, and if the patient is hypertensive also, prolonged use means more than 5 days. And at the same time, if the patient is hypertensive also, then it is important that his or her blood pressure should be monitored And if there is an increase in the blood pressure, then NSAID should be replaced with acetaminophen. So if more than 5 days of the drug, analgesic drug is required, but the patient is hypertensive also at the same time, then blood pressure monitoring is important. If the blood pressure is rising, then NSAID should be replaced with acetaminophen. Now, the most important thing is when we compare the NSAIDs with the opioid drugs, then there is a difference in the effect, difference in the dose response curve. Now, opioid drugs will not show a ceiling effect. Morphine is an opioid drug. As you increase the dose, the effect of the drug will increase. But in the NSAID category, as the dose is increased, for a particular time, the effect will be increased, but after some time, there will be a ceiling effect. Ceiling means stopping. Any additional increase in the dose, it will not give any benefit to the patient. For example, the ceiling effect of aspirin and acetaminophen is 1000 mg. After 1000 mg, if we are giving 1500 mg, 2000 mg, it will not give any further pain relief. Similarly, for brufen also, 400 mg is the ceiling effect for its analgesic activity. If more pain is felt and if 600 mg or 1000 mg of brufen is given, then there will be no more reduction in pain. So ceiling effect is an additional increase in the dose will provide no further benefit. That is known as ceiling. So if you can see in the graph here, as the dose is increasing, the effect is increasing. But after a particular dose, there is a ceiling effect. That means no more increase in the pain relief. Whereas if you see the opioid drug morphine, as you increase the dose, the pain relief is also increasing. But that is other question, that side effects will also increase in such cases. So this is about the ceiling effect of the non-opioid drugs or the NSAIDs or the acetaminophen, and the acetaminophen. Next, coming to the second category of analgesics, that is opioids. Opioids are also known as narcotic drugs. So they produce their actions by binding to the opioid receptors. Opioid receptors are those receptors which receives the opioid drugs and produces their therapeutic effects or adverse effects. The important thing is they do not have a ceiling effect. As the dose is increased, its efficacy will increase. That is the difference between opioids and non-opioids regarding the ceiling analgesic effects. But as the pain is severe, the dose will be increased. So as the patient is feeling severe pain, the dose will be increased to reduce the pain, but at the same time, the patient might suffer with different side effects also. So this is not to be forgotten also. Now, the most important thing for opioids is its dependence or potential for abuse. That means people who are taking opioids, their body becomes dependent on the drug. And when the opioid is removed or withdrawn, then the patient experiences withdrawal symptoms. So, due to the fear of this dependence, tolerance, and addiction, opioids are under prescribed. That is, they are prescribed very less for acute, chronic, or terminal pain. So, because of these fear, they are not prescribed very frequently. Dependence, as we have studied earlier, it occurs when the body accommodates to the influences of the drug. That means the body is now dependent on the drug. And if the drug is discontinued suddenly, then it will lead to withdrawal symptoms or withdrawal syndrome. So, what should be done? The drug has to be reduced gradually. Gradual tapering of the dose must be done. Basically, opioids cause sedation, lethargy, and constipation. But upon withdrawal, the patient shows opposite effects to that of the normal effects. Sedation becomes opposite. The patient becomes excited when opioid is not given. Abdominal cramping will be seen. Constipation will become diarrhea. So, in order to avoid these withdrawal symptoms, gradual tapering of the dose should be done. Immediately, we should not stop the drug. Slowly, slowly, the dose has to be reduced gradually and then finally stopped in order to reduce the withdrawal symptoms on the patients. Next is tolerance. After repeated doses or repeated administration of the drug, the patient becomes tolerant to that dose. But the important thing is tolerance develops to analgesia, sedation, and respiration. But tolerance will not develop to its constipation effect and mitotic effect. That means as the drug is given for a prolonged period of time, what will happen? The body of the patient will become tolerant to analgesia. That means if analgesia has to be produced, the dose has to be increased. To produce the same effect, the dose must be increased because the body has now become tolerant. Similarly, tolerance will be seen for sedation also and for respiratory depression also. But tolerance will not be seen for constipation and mitotic effect. As the dose increases, constipation will be severe and mitotic effect will be severe. So people who have become tolerant but still they need opioids, the dose has to be increased and it will be problematic for them because they will suffer with severe constipation and the night vision will be impaired because it has mitotic effect. Mitotic means pupils will be constricted. The pupils of the eyes will be constricted. So night vision will be impaired. But they have severe pain, so they need opioids. But what will happen at the same time? They will suffer with these side effects. Now, patient who lacks addictive behavior can be easily weaned from the opioid dosages. That means opioids can be easily withdrawn from a patient who is not having addictive behavior without the fear of having addiction. So, if a patient is not having addictive behavior, opioids can be removed from the patient smoothly. But if the patient is having an addictive behavior, then he or she will crave for the drug despite having no need of the drug. even though they do not need the drug anymore, but still they crave for the drug because they feel euphoric when they take the drug. They become addicted to the drug. So this is a general overview or a general introduction about pain, the analgesic drugs which reduce pain, and their brief mechanism of action, and their two classes, that is opioids and non-opioids. In the next week, we are going to see what are the drugs which are included under the opioid category and what are the drugs which are included under the non-opioid categories, and what are the important points, what is their detailed mechanism of action. All these points we will discuss in the next class. So I hope it is clear for all of you.